Hey, I'm Dr. John with Pediatric Dental Associates in Orthodontics. I'm a pediatric dentist here. Today we're going to be going over why it might be important to do a crown versus a filling for some of the more nuanced reasons that may not make a lot of sense initially. So maybe you're wondering, okay, why can't my child receive a white restoration instead of this metal crown that the dentist has recommended for my child? And you're thinking, okay, there's only like one cavity here. It's not even that big. I can't see it. My child has no concerns. They're not having any symptoms. So what's the deal with this crown? It all has to do a lot of times with patient indicators in addition to the tooth itself. So for example, you may have a young patient, 3, 4, 5 years of age, who is going to have those teeth for quite a long time that we're indicating for treatment. That is a primary tooth that could last as late as 13 years of age. And so a lot of times you can do a white filling, but it may not last that long, and then you have to redo the treatment in some other capacity later on. And so you're thinking, okay, maybe we need to do a more definitive restoration that is less likely to need retreatment. And that's where the crown comes in. Studies show that the crown lasts very, very long and a lot longer and a lot more predictably than a white filling. And then a lot of times you will actually recommend a crown if there's only a few cavities and maybe they're small, but your child is going to receive treatment while asleep, whether it be via IV sedation or under general anesthesia. A lot of times, whenever that is the case, it's best to do the treatment most definitively according to the American Academy of Pediatric Dentistry, so that hopefully we don't have to redo that treatment again in the near to distant future and maybe go back to the surgery center or go back to do the IV sedation. And so it's just the most cost-effective thing, and it's the most likely method of treatment to avoid retreatment of the child while they're going back to sleep for the same tooth, the same issue. So we've talked about some patient indicators today that may indicate the patient or your child to receive a crown over a filling, even when it's not incredibly obvious. And so sometimes, due to young age or a caries risk that's elevated, it may benefit your child the most to receive a preformed metal crown or a crown cap over a white filling in the tooth for the greatest longevity and to best ensure their oral health. Here at PDAO, we really care about your child's oral health and their mental well-being. And so we always want to do the treatment that's going to best benefit them long term. And so that's why we do what we do. Sometimes even it doesn't always make the most sense initially, it's because we care and we want to do the best for your child.